Hello everybody. Hello everybody. Hello everybody. My name is Eduardo Flores. I will be presenting on antimicrobial resistance. I want to thank Dr. Craig Winkleman for allowing the opportunity for a presentation like this. And let's get started. I'm going to be presenting on antimicrobial resistance with an emphasis in antibiotic resistance. Give me 1 second. There we go. Alright. What is antimicrobial resistance? So, according to the CDC, antimicrobial resistance is when germs like bacteria and fungi develop the ability to resist drugs designed to kill them. Germs survive the treatment of the antibiotic, or in this case, antimicrobial treatments, antifungal treatments for fungi, and they continue to grow and to spread. Antimicrobials are characterized on the type of organism that it acts against. For example, antibiotics are for bacteria, as stated, and antifungals are for fungi. Uh, when something becomes antimicrobially resistant, it does not refer to the body becoming resistant to the antimicrobial, but rather to the microbe itself becoming resistant. So, what causes antimicrobial resistance? Antimicrobial resistance, or AMR, occurs when an individual inappropriately consumes an antibiotic or antimicrobial while failing to effectively kill the targeted microbes. Particularly when we look at antibiotics, we see resistance to occur in a matter as so. We have an example right here. Number one is it starts with a number of germs. Some of them, before being resistant, could be already resistant to a drug, or when they're exposed to a antibiotic and they survive, they become resistant. So the same thing can happen. Then you take another antibiotic which kills the bacteria that is causing an illness, as well as the good bacteria protecting the body from infection. And then what remains are the bacteria that are drug resistant, and now they take over and they grow. They spread in the body, they grow in number, and they don't just reproduce and grow in this manner through reproduction, spreading the information of resistance, but as well to other bacteria that they can come into contact with just by literally contacting other bacteria. They can spread genetic information that will allow them to be spreading the resistant information. The use of antibiotics is the single most important factor leading to antibiotic resistance around the world. So just the fact that we have antibiotics to use is a huge reason why antibiotic resistance is a thing. Unfortunately, this is how bacteria works. It's not something that is 100% perfect, in which, they won't be able to become resistant to this drug, but in fact they do. Antibiotics are among the most commonly prescribed drugs used in human medicine. However, up to 50% of all antibiotics prescribed for people are not needed or are not effective as prescribed. Antibiotics are also commonly used in food animals, in farming and the raising of cattle, to prevent, control, and treat disease, and to promote the growth, literally physical growth, of food-producing animals. Many individuals have seen documentaries in which you see how abuse occurs in farms, in areas where cattle are raised, where chickens are raised, and they're given antibiotics in order to fatten them up. Well, this is something that contributes to antibiotic resistance. It is difficult to directly compare the amount of drugs used in food animals with the amount used in humans, but there is evidence that suggests that antibiotics are used more in food production. So, antibiotic resistance is more than just a fault of action, the overuse or the misuse, but it spreads as well. As stated earlier, um, the bacteria grows and it spreads the genetic information, but as well, this bacteria, when spreading to other individuals, they take that information with them. So it doesn't end with just the individual who has antibiotic resistant bacteria in them. As we know, germs are contagious, and spreading this type of bacteria is very easy, whether it be through uh, animals, as we stated earlier. Drug-resistant bacteria can remain on the meat of animals. When they are not handled or cooked properly, the bacteria can spread to humans, as well as when bacteria that transfer from human to animals or animals to humans, the same thing occurs. Um, Contaminated feces can contain the antibiotic-resistant bacteria and can end up on crops. Then these bacteria go back to the population. We see the other hand, which shows an individual that has resistant bacteria in their gut, for example. They go to a hospital, a healthcare facility, and they can give it to one of the healthcare providers. Um, or the provider can contaminate themselves, and if they're not properly washing their hands, can transfer this to other patients. Or even by just staying in an area with other individuals, you can spread the bacteria as well. So, what is the importance of disabling antibiotic resistance? So, each year in the United States, 2 million individuals acquire serious infections from bacteria, and 23,000 of these individuals die each year as a direct result from antibiotic resistant illnesses. Now, this number, when you divide it, statistically speaking, it's not significant, but that is still 23,000 individuals that whose death could have been prevented if resistant infections towards antibiotics were not a thing. That's 23,000 lives that could have been saved. Now, looking at this economically, the cost of antibiotic resistance ranges from as high as 20 billion in excess direct healthcare costs, with additional costs to society for lost productivity as high as 35 billion a year. Public health journalist Maureen McKenna um, states on a TED Talk in 2005 that the pre-antibiotic era was a time in which any injury could kill you. It is a big issue when we speak about antibiotics. When we talk about antibiotic resistance, it's not just that a certain drug or a certain antibiotic is becoming resistant. It is the fact that when these bacteria become resistant to these antibiotics, we're losing the amount of antibiotics that we could use in order to treat an illness. Now there are higher level antibiotics as well, but healthcare providers struggle to use these because if we introduce these higher level antibiotics that are very potent, then we're providing for the bacteria to learn our greatest weapons and to become resistant to that. So we're losing um, ammunition. We're losing weapons that we can use, biologically speaking, against bacteria. Uh, so speaking about the pre-antibiotic era, we see this in the case of a police officer, as stated by drug-resistant economist uh, Ramanan Laxminarayan in a TED Talk on September of 2014. This police officer received a simple minor scratch on the cheek from a thorn from a rose bush. Now, many of us have received similar cuts, and we just graze it off. It's nothing. If something were to happen, we have antibiotics, or the antibiotics are already in our systems through our food, or antibiotics that we take separately, can diminish or get rid of any possible infection. Now, in this case, in a pre-antibiotic era, this police officer, with that little scratch from a thorn bush, ended up having a lot of pus coming out of his head due to an infection that occurred from a bacteria growing and spreading. And the pus became so much that his eye became so infected, and it had to be removed. And ultimately, this police officer passed away. Now, we don't hear about things like this, but when we consider what else we can lose when antibiotic resistance takes over, a pre-antibiotic era uh, had a bunch of complications. Marie McKenna states that if we lost antibiotics, there are other things that we would lose. She states that any protection for people with weakened immune systems, cancer patients, AIDS patients, transplant recipients, premature babies, they all lose any treatment that could help them to survive due to secondary infections, their weakened immune systems. Antibiotics are used in order for them to be able to survive and not die from secondary infections that cancer causes, AIDS causes, due to suppressing the immune system. Premature babies, they're born with weakened immune systems in many cases, and possibly take a lot longer for their immune systems to develop, and are therefore exposed to an environment in which bacteria thrives. Transplant recipients, antibiotics are used in order to cleanse a organ that is being used for transplant. Same thing with surgeries. Um, any items that are used to install foreign objects in the body, like stents for stroke, pumps for diabetes, dialysis, joint replacements. These all use antibiotics in order for such treatments, such procedures to occur. A recent study estimates that without antibiotics, 1 out of every 6 individuals would die. Next, we lose surgery. Many operations are preceded by prophylactic doses of antibiotics, as stated by Marie McKenna. Without that protection, we'd lose the ability to open up the body and conduct surgeries in the deepest parts of the human individual and provide them the antibiotics that they need in order for infections to not occur. There'd be no cesarean sections, no prostate biopsies, no heart operations. Strepto used to cause heart failure. Strepto today is given antibiotics like amoxicillin. I've taken amoxicillin, for example, when I had strep throat, but there was some complication. I might come back to that later. Skin infections lead to amputations. Giving birth killed in the cleanest hospitals. This all speaking about a pre-antibiotic era. Almost 1 woman out of 100 would die because of birth complications due to bacterial infection. And pneumonia took 3 children out of every 10. Now, with all these complications, all these very strong, unfortunate events that could occur again, there was a warning in 1945 by none other than the discoverer of penicillin, the first antibiotic. And that discoverer was Alexander Fleming. He stated that there may be a danger, though, in underdosage of an antibiotic. It is not difficult to make microbes resistant to penicillin in the laboratory by exposing them to concentrations not sufficient to kill them, and the same thing has occasionally happened in the body. He also states that a time may come in which penicillin will be sold in shops over the counter or under the counter. Then there is a danger that the ignorant man may easily underdose himself, and by exposing his microbes to non-lethal quantities of the drug, make them resistant. This happens all the time out of experience that I hear in my everyday life, especially amongst Latinos, getting antibiotics from Mexico or from other Latin American countries, and they bring it to the United States, and Latinos here, Hispanics, in the United States, share these antibiotics with one another without them being prescribed appropriately by a physician or a healthcare provider that is allowed to give such prescriptions. Now, Sir Alexander Fleming gave an illustration stating that Mr. X has a sore throat. He buys some penicillin and gives himself not enough to kill the streptococci, but enough to educate them to resist penicillin. He then infects his wife, who becomes infected with the bacteria. So she goes to the doctor, and she's given the same antibacterial, which is penicillin. And since the bacteria that she has been exposed to and infected by is resistant to penicillin, she dies. Now, um, Alexander Fleming goes on to give a philosophical point of view as to who is responsible for the death of Miss X. And he states that Mr. X is the one who is responsible for his negligent use of penicillin that changed the nature of the microbes. So his moral is that if you do use penicillin, or if you do use any sort of antimicrobial, to use enough in order to kill the bacteria, the fungi. So there are observed negligence of the warnings, and when Sir Alexander Fleming gave that warning, it was during his Nobel lecture in 1945. He had discovered penicillin in 1941. And in his studies, he gave the warning, but in today's times, there are still individuals who ignore the warnings. A huge variety or variable to why we are falling back is because of the inappropriate use and distribution of antibiotics. Individuals take antibiotics without them being prescribed and take them inappropriately. One such case in one of my speech classes, there was a student who, whenever he became sick, or starting feeling sick, he would take any antibiotic he had left over, and as stated by him, he would just chug it down. And his hope was of killing anything that would be starting to stir up inside of his body, causing him to feel sick before it got the chance to leave him in bed rest. Now, this individual said that he had a bachelor's in evolutionary medicine and claimed to know about bacteria having the ability to develop such resistances through their evolutionary processes. Yet, he still would take antibiotics inappropriately without them being prescribed by a doctor. Not only was he taking it incorrectly, there was the fact that he said that any leftover antibiotics that he had, which means that he wasn't taking the full course as prescribed by the doctor. And not taking antibiotics as prescribed by the doctor, the reason why they give us a certain amount of time is for any additional bacteria that is still left over, even though the individual is feeling better. It is to kill any leftover bacteria that's still there, to make sure that the slate is wiped clean, that there are no bacteria left over in order to become resistant to the antibiotic. Now, according to a study on July 2016, population misuse um, was stated by the American Society of Microbiology that of 400 respondents, 20 of them, or 5%, reported non-prescription use of systemic antibiotics in the last 12 months. So they would take antibiotics without it being referred by a physician. 102, or 25.4%, reported intended use of antibiotics without them being prescribed. 57 of them, or 14.2%, stored antibiotics at home. So they were keeping antibiotics instead of completing the prescribed dosage taking by the physician. The sources of antibiotics used without prescriptions or stores for future use were from stores or pharmacies in the U.S. Leftover antibiotics from previous prescriptions, antibiotics obtained abroad, or from a relative or friend. So this is all stating that these antibiotics were used without prescriptions. They were obtained in stores in which they would easily be able to be obtained. And they were using leftover antibiotics or ones from out of country, like I stated earlier. For example, in the people that I am around, stating that they bring antibiotics from Mexico or from other Latin American countries. And here in the United States, friends share antibiotics with one another. It's inappropriate to do such things as these antibiotics are designed specifically for the individual for whom it is prescribed. The amount to take, um, the dosage, everything that has to do with it, body weight, height, it's all prescribed for that person, for that specific bacteria that they are dealing with. It's not for any bacteria because it might not be as effective, and therefore you're just giving bacteria the chance to become resistant. Now, it's not just the population or individuals who are having misuse of these antibiotics. In the medical field, it occurs as well. There are doctors who decide to abandon their knowledge and prescribe antibiotics inappropriately. As stated by Maureen McKenna in her TED Talk, 45% of prescriptions written by doctors' offices are for conditions that antibiotics cannot help. And many of these cases are because of patients who are forcing their doctors, nagging, complaining, saying that they want something, and therefore the doctor gives them something. Some are afraid to be sued, or they don't want issues, and that could be a reason why. In another study, at least 30% of antibiotics prescribed in the United States are unnecessary, as informed by the Centers for Disease Control and Prevention in May 2016. Now, here's a list of antibiotics that have been released throughout the years, antibiotic names, germs that have become resistant to these antibiotics, and in what year this was identified. Right here we see penicillin. As stated earlier, it was released in 1941. For penicillin-resistant Streptococcus aureus, exactly 1 year later, it became resistant to penicillin. We see one that became resistant in 1967, another in 1976. But as you go down this list, you start seeing that a lot of these bacteria becoming resistant more and more quickly. You can see that they're starting to become less of a time gap in between these bacteria and the time that they're resistant. This one was approved by the FDA in 1990, but by then it was already resistant in 1988. We got one right here in 2001, resistant in 2014, one in 2003, resistant in 2014, a year later, one that was prescribed in 2015, and in the same year it became resistant. Now, no issue would be complete without its proposed solutions, and that's our job as public health educators. Moving forward, we are required to seek solutions for community-based education. There are proposed solutions by the CDC. These are more epidemiological than anything, but do reference some community-based interventions. CDC suggests that laboratory and diagnostics to be assisting for detection, response, and the containing of resistant pathogens. Epidemiological capacity for response, increase the capacity in state and local health departments in some counties for rapid detection, and for faster response of outbreaks and emerging resistant related to healthcare associated infections, foodborne bacteria, gonorrhea, to contain and control the spread of any antibiotic resistant germs that may arise. So they suggest the prevention of the spreading of resistant infections through surveillance and science, keeping track of every case that comes along. Improved antibiotic use. Right here is more community-based. Right here was where we would come along and educate the population on how to properly take antibiotics. I have done so. I have spoken with individuals who take antibiotics and are bringing antibiotics from outside of the country, and I let them know that this will cause antibiotic resistance. I explain to them how this could affect. I speak to my family about these issues, and they listen to me. My family already does their best in order to take things appropriately, and if they're unsure of anything, they ask me, and if I don't know something, I research it and I let them know. It is our job to do these things. To encourage innovation for new strategies, drugs, and diagnostics, insight for practice, innovations and collaborations with academic and healthcare partners to identify and implement new ways to prevent antibiotic resistant infections. Research and development. There's another thing that we can um, promote, as in order for research and development to continue, there has to be talk about this issue, and for development of changes in industries, research is a very important factor. So doing research on these things will allow for um, this topic to be spoken of clearly, for stakeholders to become involved, for eyes to be set on the issue, and for there to be action taken to prevent the losing of the antibiotics that we need for many wonderful medical advances that we have today. Solutions that we can promote as future public health educators. These are more specific for us. Now, of course, um, the evolution of antibiotic resistance, it's something natural. It's not something that will be prevented 100%, but we can definitely take the opportunity to delay such an evolutionary trait by bacteria, and there are doable solutions. Um, we can teach the population to take antibiotics as instructed by doctors and never through other methods other than prescription. We can teach the population to ask questions. Uh, Many reasons why doctors give unnecessary antibiotics is because they believe that the individual wants it. There's been many cases in which doctors just suffer with individuals who keep asking and asking for a treatment to be given to them, even though they're waiting for lab results or they don't need antibiotics, but yet they ask for antibiotics. And in many cases, though inappropriate, some physicians are responsible for giving antibiotics to individuals who may not need it. I went to the hospital for a checkup of a throat infection, and the doctor had taken a culture of the infection that I had and sent it to the lab. And I doubt that they had results at at the same time, because as far as I know, they didn't have a lab on site. But immediately the doctor gave me a antibiotic to take. Now the antibiotic was one that um, was appropriate for the strep throat that I had. And being honest, I messed up with the taking of the prescription, and now I have a strep throat that comes along every year, especially during the cold season. Just a couple weeks ago, I had it. Um, so because of my fault, I now have a bacteria that is resistant to amoxicillin. Um, and I do realize that I made a mistake. I knew about the mistake when it occurred. I had lost track of my antibiotic taking times, and in the end, I don't know what caused me to not continue taking the dosage, but I stopped completely, and now I have a bacteria that is resistant to amoxicillin. I haven't gone back to the doctor to have them prescribe another antibiotic in order for me to remove this infection for two reasons. One of them, I already messed up once. I know that if I take another one, I wouldn't mess up with all the information that I know now, especially now that it's my responsibility to do things properly. But also because the infection isn't as bad as when I first had it. My body is used to it. It leaves within a couple days, as opposed to when I first had it. I was in bed the whole week with very high fever. Now I don't get fever. I just feel a little sore throat. But it's an experience that I've had, and my unfortunate contribution to antibiotic resistance. Um, so, if you're a medical professional or plan to become one, then establish medical authority. Um, the individual who's giving the prescription is the one who has the knowledge in order to give a prescription, not the patient. The patient can't come in and ask questions, as we stated in number 2. Express to the doctor why you feel that you may need an antibiotic, But in the end, the lab results are the ones that matter, and the doctors are the ones that have the authority to say, yes, you have the green light to take this antibiotic or to take an antibiotic for the condition that you have. Prescription checkpoints are another idea in which the antibiotic is double checked to make sure that it is the correct one for the infection that is being used for it. Faster lab results. Before a prescription is given, it would be very, very helpful in order to have faster lab results, in order to know exactly what the doctor is dealing with, and to give an appropriate antibiotic or not an antibiotic as a response to the infection. And number 7, something that very much has to resonate with us, is to raise public awareness about the misuse of antibiotics. I'm already doing it. I have my own failures in the past, but I still preach what is the correct thing to do, which is to properly use antibiotics and to express the dangers of the consequences of inappropriately taking antibiotics. So that is the culmination of my presentation. Here are the references that I have taken. If you have any questions, feel welcome to contact me. I have a huge, so to say, library of resources in which I have taken this information from, apart from the ones that you see right here on the screen. These are directly what I've referenced for this presentation, but I have a lot more information on antibiotic resistance that can prove beneficial to your journey. Thank you.